My name is Amol Nirgudkar. I'm the CEO of Patient Prism, and I'm delighted to welcome Rachel Wall here from Inspired Hygiene into our studios, and we're talking about all things hygiene. What do you do to optimize your hygiene department? And Rachel is one of the most well-known experts in the country that focuses on training dental practices on how to really improve their hygiene department and thereby improve the lives of their patients, right? Yeah. So we know the statistics, right? And I've read them in your book, which says 47% of adults in America have periodontal disease. The percentage is even higher with older adults. Yeah. And so you talk about this 3 Ps of perio enrollment. Let's give our audience a flavor of what that means.
Mm-hmm. So the 3 Ps of perio enrollment are really, how do we make it easier for the patient to say yes to the treatment that's in their best interest, that their hygienist is presenting?
Okay.
So we want to set the hygienist up for success, and we also want the patient to be a part of the diagnostic process, right? There's nothing worse as a patient than being with your hygienist for 40, 45, 50 minutes, and then all of a sudden at the very end, the bomb gets dropped of, hey, guess what? You need, 3 crowns and you have gum disease. So let the patient be a part of that process all along the way, right from the beginning. Okay. So the first P is prep. Okay. So we want to prep the patient for the periodontal exam, right? And it sounds something like this. So the first P in the 3 Ps is prep. Okay. So we want to prepare our patients for the perio exam. Okay. So if I'm the hygienist, you're the patient, I would say Amal, the next thing that we're going to do is a very thorough exam of your gums and the bone that supports your teeth. Okay. Okay. And I'm going to call out a bunch of numbers, and I want you to listen to these numbers. 1 to 3 is typically normal, and healthy gums don't bleed. Okay. All right, so that's the prep. Really simple. I don't need to say a whole lot more. I don't need to tell them all about everything that's involved in periodontal disease right now. I need to keep it super short. Sure. Right? Then the next step is I'm doing a complete perio evaluation. And we recommend that at a minimum, practices are doing this once a year. And really for perio maintenance patients, they're doing complete perio exam at every perio maintenance appointment or at least every other perio maintenance appointment, right? Okay. So they're really monitoring that very closely. That's the whole point of perio maintenance. Right? And so when we're doing this and we're collecting this data, we're calling out these perio readings to our patients. Sure. Whether we have an assistant in there that's helping us, whether we have voice-activated charting, or we're in there on our own and we're plugging the numbers into the computer, we need to be calling that out so that the patients are involved. Sure. And when we see bleeding, we need to be letting the patients know, hey, you know what, there's bleeding in this area. Grab this mirror and let's take a look at this. Have you ever noticed this before? Right. Do your gums bleed when you brush or floss, right? So just making them aware of what's going on. And then once you've completed that exam, you're sitting the patients up, and the 3rd P is present, right? Okay. So now it's time to present, what has been revealed. Okay. What has been revealed by this perio exam. And so one of the tips, like I hinted at, was sit the patient up, right? We don't ever want to present treatment when the patient is lying back. It's a very vulnerable position. The next step is I believe it's important to print out that perio exam in color so that the patient can see all these red numbers are over 3 millimeters. Sure. And all these red dots is where there was bleeding, okay? Sure. Now, everybody has, a lot of practices have a really beautiful monitor right in front of the patient that they can show that on. That's fine. I will say, though, that we have found, and we've gotten feedback from our clients, that when they print it out and the patient holds it, it's different.
They get to see the whole thing.
They get to see it. And also, I can use my highlighter or my red pen or whatever, and I can circle the areas where there's infection, and then I can address that, right? I can let them know, this disease is localized, so we're going to treat it in a localized manner. Sure. So we're presenting that. Okay. And it's important to share with the patient a couple different things in that presentation model. Sure. One is the good news is, right? Okay. So the good news is that the infection I'm seeing is localized, right? It has not moved to your front teeth yet. Okay. Right? However, you do have some active infection. You have some gum infection, or you may have heard it called periodontal disease. Sure. Okay? So is there some good news? What do they have? Instead of I found disease, you have disease, right? That's a way to help the patient own the disease. Sure. I'm concerned because this is a great time to tie in any medical conditions that they might have.
Right.
I'm concerned because you also have diabetes.
Right.
And you've mentioned that it's hard to keep that under control.
Sure.
And gum disease can actually contribute to that and make it harder to control your diabetes.
Sure.
I'm concerned because I know that you really like to smile. You're a really friendly person and you want to keep your teeth for a lifetime, I would think.
Sure.
And we recommend. So to address this infection, doctor's going to come in and confirm all of this, and what we typically recommend is, this type of therapy. And I would also recommend that we include, some type of testing or local antibiotics or whatever it is that you really believe in your practice.
Sure.
Enhances the scaling and root planing, and then just keep it within that, those 4 things, right? You have the good news is. I'm concerned because, and we recommend. If you can keep it in those lanes, it can help it be precise. And then just ask the patient, what other questions do you have for me? And let them share with you what's coming up for them.
So when you take the patients through the 3 Ps, you really are making them aware of a problem without kind of scaring them at the very end.
Yeah.
You're prepping them.
Yep.
They themselves are coming up with the diagnosis along with you.
Yes.
Then you're doing a thorough exam. And then at the end, you discuss this, right? You discuss it with them. And the dentist comes in and obviously you discuss if perio is more important now or the restorative stuff. And it becomes a more, a path for a patient to truly understand the gravity of what's going on with their mouth. And really, and you're able to enroll more patients within your Perio program. And I think we should do a segment on that. But great, 3 Ps of Perio enrollment, really important. The 3 phases are really important to get patients buying into their own health. And so thank you for this discussion.
Yeah, my pleasure.